மாதிரி இருக்காங்க. ஆனா எனக்கு இது வந்து எனக்கு என் குழந்தைங்க வந்து நல்ல செட்டில்மெண்ட் 5 இயர்ஸ்ல வந்து எனக்கு பிரிட்டிஷ் பாஸ்போர்ட் வந்து வருது. புரியுதா?
Okay, chronic fatigue syndrome, myalgic encephalomyelitis or chronic fatigue syndrome is a condition where you have long-term disabling tiredness. Most people will also have one or more other symptoms such as pains, muscular pains, joint pains can also be there, disturbed sleep patterns, poor concentrations, and headaches. The cause is not known. So mainly along with the muscle pains, your patient can also complain of joint pains and sleep disturbances, poor concentration. That's why the school performance will go down, and they may also have short-term memory loss. They may have memory loss as well. So poor concentrations and even headaches. So always in the history, don't forget to ask about headache as well. The chronic fatigue syndrome is a condition that causes marked long-term tiredness and other symptoms which are not caused by other known medical conditions. ME stands for myalgic encephalomyelitis. Myalgic means muscle aches or pains. Encephalomyelitis means inflammation of the brain and spinal cord. Okay, what happens exactly here? There will be muscle pains, and due to inflammation of the brain and spinal cord, you may also have the other problems like headache and even concentration problems, memory problems, cognitive problems. CFS stands for chronic fatigue syndrome. Chronic means persistent or long term. So however, there is controversy about the nature of this condition. There is no test to diagnose the condition. The diagnosis is made in people who have certain set of symptoms which can vary in type and severity. And there is even controversy about what to call this condition. Many people, including some doctors, think ME may represent number of different conditions rather just one condition. Okay. So what are the symptoms? I will not go to read much, only I will go superficial. We can read by ourselves later. Tiredness is the common symptom you will see. The most common main symptom is persistent tiredness. The tiredness is of new onset that has not been lifelong but started at a point in time, causes you to limit your activities. This tiredness will limit the activities compared to what you were used to. It often felt to be both physical and mental tiredness and is said to be overwhelming or to be like no other type of tiredness. For example, it is very different to everyday tiredness, such as after a day's work. It is not eased much by rest. It is not due to like tiredness from overexertion. It is not due to muscle weakness. It is not loss of motivation. So tiredness is the main thing. Okay. And this tiredness is often made worse by the activity, and this is called post-exertional malaise. However, the post-exertional malaise usually does not develop until the day following activity. It then takes several days to improve. So it will not just improve by rest. If this can take several days to improve. Okay. Other symptoms what you can see is the cognitive difficulties. This is very important in the history. The mother may give you that it's not concentrating in his studies. So what are the cognitive things you will see is the poor concentration, poor short-term memory, and reduced attention span, and poor memory for recent events. Like in our case, I said that there is loss of short-term memory. He's not remembering the things what he's doing at school. So poor concentration, poor short-term memory, reduced attention span. He cannot give attention to the things for the long time like how he was before. It is reduced now. Poor memory for recent events, difficulty with planning and organizing your thoughts, difficulty in finding right words to say. Even they may have problems to put the right words when they are talking. Sometimes feeling disoriented. Sleeping difficulties. So we read about physical and mental. Now sleeping, for example, early waking, being unable to sleep, too much sleep, or disrupted sleep wake patterns. They may have problems of sleeping at night. They are unable to sleep. They may wake up early, or they may sleep too much. The different people may present in different ways. Disrupted sleep or wake patterns. Pains, most commonly muscular pains, joint pains, and headaches. Recurring sore throat, often with tenderness of nearby lymph glands. You can also see that. A range of other symptoms has been reported in some cases, like dizziness, feeling of sickness, nausea, palpitations. Physical and mental exertion will often worsen the symptoms. So prognosis is actually mild cases, moderate cases, and severe cases. Okay. We will, I think in severe cases, they will be most of the time bedridden, difficulty, wheelchair bound. You will see in severe cases, you will be able to carry out our minimal daily tasks such as face washing and cleaning teeth. You're likely to have severe difficulties and with some mental processes such as concentrating, wheelchair dependent for mobility, and may be unable to leave your home except on rare occasions. But our case, I think we can say it comes under mild to moderate. You can care yourself, do light domestic tasks, but with difficulty. You are still able to do a job, may often take days off. In order to remain in work, you are likely to have stopped most leisures and social activities. Weekends and other days of work are used to rest in order to cope. So this is mild. They can do the activities, but they need rests for few days in between. Moderate is you have reduced mobility and restricted in most activities of daily living. Means you don't prefer to go out, you feel to stay at home. The level of ability and severity often varies from time to time. You are likely to have stopped work and require rest periods. That means the child can be made to stop from the school for a few days and then given the as he improves. So it depends. You have to categorize. In severe, you will be usually wheelchair bound. You may need a wheelchair to go out. So if a child is able to walk and can go out and do the activities, you can divide it as mild and moderate. If the number of absence is more to the school and refusing to go, it will be moderate. But he can go with very few absence and do it, and weekends he can cope up. This will be mild. So diagnosis, here is the important things. There is no test to prove that this is ME. A doctor will usually ME based on the symptoms. Some tests will be done to rule out the cause of tiredness or fatigue. For example, to rule out anemia and underactive thyroid gland, that is anemia and hypothyroidism. So here you will never miss to tell the CBC and TSH, T3, T4, TSH. Then liver problems, so you will ask for the liver function tests, and kidney problems, kidney function tests. So basic things what we will ask in this, but further we will read. Till now CBC, thyroid function tests, and liver and LFT and KFT. All these tests are normal in people with chronic fatigue syndrome. Okay, so sometimes the mother can tell you what is done so far. She can tell here most of the investigations were done and all of them were normal. And even the case what they give, they might give you that CBC, KFT, LFT, thyroid function tests were done and it was normal like this. Some tests will be listed which you have to concentrate when you're reading your case. What causes myalgic encephalomyelitis? The cause is not known. There are various theories, but none has been proved. A popular theory is the viral infection may trigger the condition. So in our case, we told about chickenpox. The patient had. It is well known that tiredness is a symptom that persists for a short time following certain viral infections. For example, glandular fever and influenza virus can cause fatigue for several weeks. However, most people recover within few weeks from the tiredness that follows viral infection. Even if viral infection is a trigger of ME, it is not clear why symptoms persist when there is no evidence of persistent infection.
Like this, just COVID-19.
Yeah. Factors that are thought to contribute or to some people: inherited genetic susceptibility, viral infections such as glandular fever. So we can, when we take the history, the mother can also tell that he had recent sore throat, and the doctor said some viral infection like this. We have to concentrate on the triggers always. Exhaustion and mental stress, depression or traumatic event. Okay. So we will go, most important for us is the age group for children. See, the most common age for it is early 20s and mid 40s, but for us, for children, it will be 13 to 15 years. So the child whom they would have given will be in this range, 13 years, 14 years or 15 years. In children, the most common age is 13 to 15 years, but it can develop earlier age. What is the treatment of myalgic encephalitis? This is very important for us. There is no known cure, although treatment may help to ease. You are likely to be referred to specialists who will be able to offer you support and treatment. Treatment may be considered what? One is the management of your symptoms. Painkillers may help if muscle and joint pains are troublesome symptoms. If they are troubling you too much, painkillers can be used. Eating little and often may help you, it may help any feeling of sickness, that is nausea. If you have any nausea, better to eat little and more and less and many times. Specific diets have not been shown. So mainly is the painkiller in the medications. Depression can occur in people with ME, as it can be in many other chronic diseases such as heart or lung disease. Depression can make many symptoms. Antidepressants may be prescribed if depression develops. This will be lost for us. The main things will be this. Management will be managing sleep, managing rest, relaxation, pacing, diet, all these things.
Lifestyle modification mainly.
Yeah, it is mainly you will be given advice about your sleep. Any changes in your sleep pattern, for example, having too little or even too much sleep may actually make your tiredness worse. This includes sleeping in daytime, which should be ideally avoided. Any changes to us should be done gradually. So you will, that is why a diary is important. The mother should write that now, before how he was sleeping, she will tell you. She will also tell now how he is sleeping, but she should make a record over a period of time, like how long he is sleeping. Is this child has sleep deprivation or he is sleeping excess? Both are bad, and they want to avoid. They want to avoid daytime sleep. Encourage the child to sleep in nighttime, making him to be awake and involved during the day. But all these things has to be done gradually. If you do at once, he will feel more tired. So next is the managing rest. Setting aside times to rest rather than actual sleep is very beneficial. You should introduce rest periods in your daily routine. This should ideally be limited 30 minutes at a time and be a period of relaxation. That means rest doesn't mean that you should sleep only. They will just have a time of, this is called a balance between, I told also before, a balance between activity and rest. Okay, there should be a balance. Like you will give him to do some activity, but at the same time, immediately afterwards, you will give him rest. Maybe if he's too much, he needs more time to rest, you can give him to do 30 minutes activity and 40 to 50 minutes rest or 1 hour rest, like this. But make him to do activity and rest. Slowly you have to increase the activity time and decrease the resting time. So setting aside times to rest rather than actual sleep is very beneficial. So this should be ideally limited to 30 minutes. Next is the relaxation. Relaxation can help to improve pain, sleep problems, and stress and anxiety. There are various relaxation techniques, such as guided visualization and breathing techniques, which they usually do in yogas. Like they teach different breathing techniques, which you may find useful to build. So just you can tell that some techniques of relaxations can be introduced and taught to them, like breathing techniques. I don't know what is guided visualization. Anyone has idea?
What is that, Dr. Noor? Guided
Visualization. What is this?
visualization
So
or
it
guided
is type of
exercise?
It is type of this in the meditation that they will tell you that you have to feel like your body has a lot of energy and you have to feel positive about your body. You don't have any
That's
fatigue.
what I'm telling.
It's
Like
just a form of meditation.
these are all yoga related things, right? What they do. Yeah, people also
Exactly.
teach
Yes.
the breathing techniques and the guided. Okay, so pacing. In pacing, this means balancing periods of activities and rest. Okay, becoming aware of which activities demand most from you. You should aim to stop activities before you feel the impact so that you have enough energy in reserve. So slowly, in the beginning, you can give them more rest and less time for activity, but slowly you should be increasing so that finally you will come between equal between the activity and rest. And then as they improve, you can increase the activity. So you should aim to stop activities before you feel impact. So when they feel tired, it's better they stop to do the activity. Doing too much on a good day may make you feel impact later. So it's a gradual change. That's it. Pacing. Try to pace a balance between activity and rest. Diet. It is very important that you have well-balanced diet. You should try to avoid any food and drinks which are sensitive. Eating small regular meals which contain some starchy food is often beneficial, so that they should not go hypoglycemic as well. So small regular meals, starchy, you like if anyone is not well, we always tell them to take a small meals in more frequency. The same thing here also, it's, but there is no particular food they are suggesting. They are telling starchy foods, maybe this is because to cover up the sugar or hypoglycemia, maybe. Other treatments, graded exercise therapy and cognitive behavioral therapy.
High glycemic index. High glycemic index. Starch, very high glycemic index.
Yeah. So this will avoid the any hypoglycemic episodes.
Yes, yes.
So graded exercise therapy and cognitive behavioral therapy has been recommended by NICE guidelines, but may not be of any benefit or even make symptoms worse. But don't tell this, because I think in NICE guidelines, it is mentioned, this cognitive behavioral therapy and graded exercise therapy. So general support, depending upon the severity of illness, other supports may be needed. For example, carers, nursing support, equipment, adaptation to home, and help overcome disability. If you are employed, your doctor will be able to advise you about whether you should take off your work. This is for the adults. For the children, take off from the school, okay? Take time off from the work. If you take time off from work, when you may be ready to go back to work, it may be that you need to work doing slight different hours or even with different duties. If you have an occupational health department at work, they will be involved. You will also be regarding, that's what you should, like for children, you will take school off, and also you will be coordinating with the school depending upon his condition, like how many classes he can attend per week. Complementary treatments. As there is only limited success in conventional treatments, it is understandable that many people with ME finds various therapies helpful. However, there is not enough research evidence to support the complementary therapies. Like there is also insufficient evidence for the supplements like vitamins. There is no much evidence. So when there is relapse, what you will do? How do you manage? It is common to have setbacks when symptoms become worse for a while. This can have various triggers. For example, poor sleep, infection, and stress. Maybe these children, if they sleep well, they may not have problems. But sometimes due to some stress or something, if they have poor sleep or they get some infection or stress, this may come back. I mean, they may have a relapse. Your doctor may discuss with you the strategies which may help during setback. These may include the relaxation techniques, talking with your family, finding a right balance between activity and rest. However, it may be necessary for you to reduce or even stop some of your activities. So for prognosis, it's a fluctuating course. When symptoms are not too bad and times when symptoms flare up and becomes worse. The outcome is very variable and there is currently no effective method for predicting how the illness will progress, whether it will improve or resolve. So I want to ask about the prognosis when compared with adults. How is the prognosis with children?
Prognosis is not so good. Many of them have chronic lifelong condition. Many of them. I think percentage I can't remember, 30 to 40%.
No,
It
today
goes into chronic.
it's 20 to actually in children it is good, they will improve. Okay, I will share one video today. I watched one video about it. It is from NHS only. So it's shown that the prognosis in the children is better than in the adults. More chance that they will return to full normal health. And regarding the prognosis, the severe category can be 20 to 25%, which are bed bound, house bound, and wheelchair bound. Rest of
That is why
75% of the chance that you will recover. Again, all depends upon how much you will work on it, like activity and rest and introducing lots of things to them. All those things what we read. Okay. So there is about the cognitive behavioral therapy and the graded in the nice guidelines. Everyone just go through it. But they have also said here, this is on 30th March 2021, update, because of large number of comments received during consultation of the chronic fatigue syndrome guideline and the additional work needed to respond them fully. The publication date has changed. The guideline will now publish on 18th August 2021. They are planning to post the new guideline on this on August, in August. But still, you can just go through whatever is there in the present guideline about these two things, cognitive behavioral therapy and graded exercise therapy. Okay. So anyone read the NICE guidelines before about this condition?
I have one leaflet from the chronic fatigue syndrome. Okay, I'm sharing it to you.
Okay.
You can share it. Okay. Chronic fatigue syndrome. I give it to my students. So I have this one. Okay. Okay, shared in your group. This is, I think, very brief, short.
I think brief short only is needed actually. Because
because you cannot,
you will tell them.
Remember.
Yeah,
you cannot, and only time is only 6 minutes, you know, and they will ask question only 6 minutes, because 2 to 3 minutes you will present the case. So there is not so much time for you to ask question.
symptoms and all is okay. For us, main thing will be like the treating and so for us, we will just read about the treatment here. This is more important for us. Treatment of chronic fatigue syndrome aims to relieve symptoms. Treatment includes CBT and a structured exercise program called graded exercise. And then medicines if needed to control pain, nausea, and sleeping problems. Most people with CSF get better over time, although some people do not make full recovery. It is also likely periods when their symptoms get better or worse. When they become worse, this is called the relapses. Children and young people are more likely to recover fully. That's what I told you. I saw that video, and in that video, they told that compared to adults, the prognosis in children is good.
You know, Dr. Noor, there was some past test video of chronic fatigue syndrome history taking. Okay. The parent were asking, what is the, not history, communication. Parent were asking, what is the prognosis? In that I saw they said some 20 to 30% they goes into chronic condition. Maybe
Yeah,
this 20 to 30% they are not counting much. Yeah.
Yeah, but that's what I told. The recovery is good, but 20 to 25% have the chance to go into severe where they are bed bound, they are in the house, or even if they come out, they need a wheelchair. So this is the thing. The percentage 20 to 25. Okay, anyways, this leaflet I will share in the group, and it is simple to read and remember. I think enough. This was posted on the 4th April, in the April 2020. You mean the date here?
Yeah, it is actually revised guideline, April 2020. It was revised. I took it from Ghosh, I think Ghosh or something.
Yeah, even it is good because if it is small, it's easy to read, at least during the exams, just to go through what we will tell.
And you have to read this leaflet for communication also. That's why I always prefer these leaflets. You know, every disease has leaflet in NHS. Even every procedure, bone marrow, every procedure has leaflet.
Okay, thank you so much for sharing. So if there are no other questions, I will just end the meeting. Okay.